Hello, I'm Donald McCauley. Welcome to medicsvoices.com, where we speak to the key opinion leaders in health and medicine around the world. Today we're in Portugal, talking to one of the leading academics in Portugal. Raquel, it's very nice to talk to you. Now, you've just come from your annual conference. Tell me about the energy and the enthusiasm of your colleagues at the annual conference.
It was a very nice meeting after all this time of pandemics. It was superb to meet all my colleagues and to see how they manage in terms of their daily life with the patients, but also with all that is changing in our country, and I think everywhere, because of this crisis that is happening. But it was superb to know that people still enthusiastic and have the guts to do better. We have also the privilege to have Yona Heath with us in the first conference, and her energy is always fantastic. And there was a moment of emotion hearing how we can make the difference after all. And although everything that is happening, that is concerning, and all the burnout that medical doctors are facing nowadays.
Now, you gave a keynote address yourself. Tell me about your keynote address and what the topic was that you covered.
My keynote was about teaching uncertainty in medicine. And nowadays, it seems to me that is a very important subject because of COVID and all the change in symptoms and in being sick. What I addressed was that uncertainty is a normal process in medicine, in all ages and all the phases of our career. But there are some strategies to deal with uncertainty, and which strategies are better to face uncertainty in our meeting with patients. And we have some strategies like technology, decision support tools, telemedicine, electronic health records, online resources, wearable technology, and the fundamentals of our being as family doctors, knowing patients, involving patients in decision-making process. All these strategies can be used to face uncertainty and to deal with the challenges of difficult clinical cases.
Now, you spoke earlier about the crisis facing medicine and indeed facing primary care. How is that crisis affecting doctors in your country?
Very much. We are facing crisis and lack of payment. People don't feel motivated to be in medical career and in the national health system. So we have many young doctors that are going to other countries and are trying to leave the national health system, searching for better conditions of work, not only payment, but respect from other colleagues and from the patients. And we are in terms of losing many doctors that are achieving the end of their careers now. And although we have been having a big effort in pre-graduate and postgraduate medicine, and we have many young doctors with a very good vocational training, there are no place for them in the national health system because of financial constraints. So it is very hard to motivate these young doctors that had to have very good marks to enter medical school, to ask them to be motivated to face these challenges and these bad work conditions and bad retribution and poor respect from the peers and the government and the patients and all the society. So we are facing a crisis now. We have some patients that don't have a family doctor, and we could place good new specialists in general practice that will be lost because of the lack of investment in human resources for the health ministry.
And where do these doctors go, and what do they do if they cannot get into postgraduate training or into general practice?
Some of them go away for foreign countries where are very well retributed comparing with Portugal. Others go to the private initiative where they can have a place nearby their home. But in Portugal, this is not a problem of rural and littoral areas, because in Lisbon and in the area near Lisbon, there is a big lack of family doctors nowadays. I suppose because it's so expensive to achieve a home, but also because health units are in a very bad shape there. So we have inequalities, even in the capital of Portugal. We have people who have very good access to primary health care and hospitals, and we have some people that don't have a response. And this concerns all the people, of course.
Does that affect medical schools and the number of students going into medicine?
I heard that last year, many students, medical students in my university, that was the one who had great marks, quit in the first year. So I think that is demonstrative of the situation and lack of motivation to continue.
That sounds very, very difficult. How is that affecting research, and in particular your own research career?
That affects research because we have to deal with clinical points, so we don't have time to do much more, and that is not good for us, for sure.
It's a very bleak picture, isn't it? Have you any positive notes to finish on?
The positive notes is that we had a tradition of very good vocational training, and we have a very good tradition of pre-graduated formation. So it is possible to revert this situation if there is money and willing to do so. I hope the Ministry of Health start to think more about the dignification of our profession and how important it is, and how it makes a difference every day, and how it made a difference in pandemics working with people in the field, and to revert this in order to continue what we were doing in the last decade.
It's very nice to finish on a positive note, and I hope we see the changes that bring forward these young, well-trained doctors back into practice. Raquel, as always, it's lovely talking to you. Thank you very much indeed.